time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today we're going to be talking about weight loss. So guys, we're talking about weight loss today, and this video is a bit of a disclaimer video, a bit of an explanation video, addressing a problem that I've heard a lot of people speak about, and I just felt as though I needed to kind of come on here and give my own perspective. Some of you may have gone to see a doctor and been told you need to lose weight. You're overweight, you're obese, you're getting lots of health problems, you're at risk of all these things because of your weight, you need to lose weight. And that conversation is something that a lot of people have had quite commonly with doctors. And it is a conversation, maybe not in those kind of words, but it is a conversation that I've had with my patients about weight loss, about obesity and the risks that come along with it. And you will have noticed, if you've watched any of my previous videos, my Medicine Monday videos, if you haven't watched them, when you finish the video, have a little look back, and if it's interesting to you, please subscribe. But in those videos, I may speak about some conditions, and I talk about the risk factors that can, increase your risk of having certain conditions. I've spoken about weight. I've spoken about being at a healthy weight. And that can mean that you might need to lose some weight. It might mean that you need to gain some weight, but it is something that I have spoken about and I do speak about with my patients. But the reason I've come on today is because I have heard too many stories now from different people, from people in my personal life to people on social media, say that the way in which their doctor spoke to them about losing weight has badly affected their self-esteem and their mental health. And the quest to lose weight is something that is impacting people on a massive scale. Now, the tool that we use to decide if somebody is overweight or obese definitely needs some improving. We use something called the BMI, which is a calculation that takes into account your weight and your height, and then it gives out a number that says whether you're overweight or not. A healthy BMI would be between the numbers of 19 and 25. If it's between 25 and 30, that's usually overweight, and between 30 and 35, that's obese, and then 35 and upwards, we get into morbidly obese and different categories like that. It is an important topic to speak about because there are a lot of impacts on our health from being overweight. And but I want to kind of discuss the impact of this weight loss society that we're in at the moment, and the impacts of some of the desirable bodies that are shown out in the media, how it affects people too. And so, first of all, from a doctor's perspective, being overweight, it can increase your risk of having a few different quite important conditions. These include type 2 diabetes, heart disease. It can increase your risk of some cancers such as breast cancer and colon cancer. And so the reason we talk about it can be important, is important. There also are some symptoms and some other conditions that you can kind of impact on. So for example, being overweight can cause problems with breathlessness, with lack of physical activity. It can cause problems with pains in your joints and your backs. It can cause problems with snoring, and then because of a lot of the narrative that's around people who have different body shapes that are more overweight or obese, is that it can cause low self-esteem in people, and it can cause isolation as well. So there are lots of impacts of being overweight, being obese. Some of them are ones that science tells us about that we can't really avoid. We can't avoid talking about, but some of them are more society problems, and that when it comes to appearances. And when I talk about weight with my patients, it's not that I talk about it to say that they don't look good, because I have seen countless women and men out there who may be in the overweight or obese category that look amazing, that look fantastic, have beautiful bodies, but sometimes the impact that can have on our lungs, our heart, our joints are things that we can't ignore. And so when I come at it as a doctor, I'm not saying that because you're putting yourself at high risk of certain things by being of a certain weight, I'm not saying that you don't look good. I'm not saying that you don't deserve to wear whatever clothes you want to wear. I'm not saying that you don't deserve to be in relationships and have love and have a fulfilled life. And there's a woman that I actually follow on Instagram. She does YouTube videos as well. Her name's Cece Lisa, and she is a woman in the body positive community, and she's a woman that is of a high weight. And she has this saying that she says, and it's, don't wait on your weight to live the life that you want. And that's exactly what I feel. I feel like I really want to empower people to love their bodies at every single stage, and to take any opportunity that comes along and not wait for your weight to be a certain thing before you go ahead and do anything. But I think it is important to discuss how we as doctors kind of speak to you as patients about your weight and, you know, the impact that it is having. And so what I did, I went onto my stories, and I, on Instagram, if you're not following me, it's Life with Dr. Amanda over on Instagram as well. Please go and hop over after this video. But I put out there saying, has anybody had a conversation with their doctor about weight loss, and was it a negative or a positive experience? And I've written them down here on my iPad about some of the things that were shared, and so let's just have a little look. I had one of my followers tell me that she was told that she needed to lose weight, even though she expressed to them that she was exercising regularly, she stayed away from processed food, and she was doing a lot of the lifestyle advice that they were giving, but she was still told, it doesn't matter, you just need to lose weight, sort it out. And she said that this conversation came about because she had a rash that she then thought was a fungal rash, and she bought some over-the-counter cream to use. It hadn't gone away, so she'd gone to her GP, and her GP had said, well, the reason that you're, I'm surprised the rash hasn't cleared up with that cream, basically, and the reason is because of your diet and because you're overweight. And then she proceeded to tell the doctor about her diet, about her lifestyle, and there wasn't much interest in that. It was just, you're overweight, you need to sort it out. Another example was one that really, really upset me actually, and it said that doctors have, this is another one of my followers that is of a larger body type, and said that doctors have often been quite distracted by her weight, so that they're not actually able to see the fuller picture of her and her life. And she said that when she went in for her postpartum check, they wanted to focus more on the shock that she, as a plus size woman, did not have gestational diabetes, even though she was there trying to tell the doctor that she had postnatal depression. That is never okay. But that was another thing that was shared. But she also did say that when she herself had brought up weight with her doctor, they had been helpful, and she received support in the thing of like vouchers for things like Weight Watchers, and also being given gym passes and things like that. And then I had one of my male subscribers, followers on Instagram, tell me that he went in and see the doctor, and he was told based on his height and weight that he was overweight. And they went on to do an ECG, and so he had to take his top off and get the stickers on. And whilst they were doing that, they then realised that actually he has quite a muscular physique, and that may be why his numbers are high. And so those are just three of the experiences that I thought were very interesting. Because the thing is, with obesity, with being overweight, it isn't the only factor of a person being at risk of disease. If you are someone that's living, you can be a skinny person who has much higher risk of having long-term chronic health problems compared to obese person that looks after themselves. If you're being active and you are getting your heart rate up, you know, regularly throughout the week, if you're eating a well-balanced diet, so if you're staying away from those really processed and sugary foods, but your weight is still higher than desired, doesn't mean that you are a lost cause, and it doesn't mean that you're going to have this terrible disease-filled life. Also, just because you're overweight doesn't mean all your problems are being overweight. And we've got to stop, as doctors, as healthcare professionals, just seeing, oh my goodness, the person's overweight, their knee's hurting, they're overweight, I can't do anything for them until they lose weight. Because there's so many things that we can do, and we know that weight loss is not a linear process. We know that weight loss is not an easy process. to do for a lot of people. And so writing off somebody and not being willing to help them, or not being willing to look at other diagnoses, other problems that they might be having based on them being overweight, is just negligent in my opinion. And so I guess this video is really a message to you as my viewers, as you know, people of the public, people that may be patients, that you're not just defined by your weight, and that your doctor should be looking at things more than just your weight, and should still be willing to help you even if you are struggling to lose the weight as well. But also to realise that there are some conditions, there are some health problems that come along with having a higher BMI. But I say having a higher BMI because there's so many problems with the BMI. Just like that last, one of my last followers that shared, if you have a muscular body, muscle is quite dense, and so your BMI might be high, but you're a very fit person. And so there are limitations, and these are limitations that we know as healthcare professionals and we've got to take into account. But going forward on my videos, I am going to be speaking about how to take care of our bodies. I don't want to be concentrating on the numbers that are on scales. I don't want to be concentrating on talking about being fat and being obese. And in some of my videos, you may see that I say a risk factor is being obese. But I just want you to know that I am seeing you as a whole people. I think prescribing weight loss to everybody that's overweight and telling them to do it no matter what, sometimes is like saying to every woman out there that breast is best and that you all should be breastfeeding. We know that when you look at just breast milk and formula milk, just on a calculation scale, like how they are, what their components are, yes, breast is better. But when you look at the actual whole individual, the person that is struggling with mental health issues, maybe postnatal depression, the person who has cracked nipples and infections of the breast, the person that has had issues maybe with their body confidence or has had sexual assault in the past and they're just starting to reclaim their body as their own, the person that needs to take certain medications where the medication goes to the breast milk and isn't safe for the baby. For those people, breastfeeding is not the best option. Formula is most definitely the best option if it's for those kind of individuals. And just like weight loss, if you're struggling with if you've had some stresses of bereavement, if you're doing all the right things but you're still struggling to lose weight, if you're someone that is lacking confidence, is really struggling to have self-esteem and like who they are, telling someone that they need to lose weight over and over again isn't the right thing for them in that moment in time. What I want to promote is caring for yourself, is to love your body, and along with loving your body and caring for yourself does come some healthy habits. Caring for your body is moving your body, keeping active, is fueling your body with wholesome things. And so I will continue to promote those things, but I just want you to know, you're not defined by your weight. I know a lot of us as medical people, healthcare professionals, we speak a lot about it, but you are more than that. And in my videos, if I do talk about diet, if I do talk about how to lose weight, or if I do talk about exercising and things that you can do with that, just know that I do see you as a whole individual. I don't think your weight is defining you, but I think there are some things that we can address and deal with. Obesity and being overweight is becoming more and more prevalent as time is going on. And I actually got some statistics from the health survey that was done in England in 2019 about the numbers of people that are obese and overweight, but I don't know if it's relevant for me to show right now, because really the message here is that don't wait for your weight to live the life that you want to live. Take control of it. Have these healthy habits that you can be a more rounded person, so that you can fuel your mind and your body correctly. But if you're not happy about the way in which the doctor has spoken to you, go and speak to them. Tell them what you're struggling with, tell them what you're doing in your diet, in your exercise, and see if there's more practical and individual advice that you can be given. I'm not someone that advocates fatty diets. I'm all about lifestyle changes. I'm all about things that you can sustain, habits that you can sustain that can make you not just healthier physically, but mentally, emotionally. And so I hope that the message has come across. I know it's a bit of a different video from Medicine Monday, but it's just something that I felt was really important to share. And I hope that it's empowered some of you that coming from a medical professional that knows all the health things that come along with being overweight, to really take that time to have more confidence in yourself. But thanks for watching, and I'll see you soon.